Chronic obstructive pulmonary disease, COPD. Definition: chronic obstructive pulmonary disease, COPD, is a progressive, irreversible lung disease that makes breathing difficult by obstructing airflow in the lungs. It includes chronic bronchitis, long-term inflammation of the bronchi with mucus production. Emphysema, damage and enlargement of the air sacs, alveoli, reducing gas exchange. Causes and risk factors. Smoking, primary cause, including passive smoke exposure. Genetic predisposition, e.g., alpha-1 antitrypsin deficiency. Air pollution, indoor and outdoor pollutants. Occupational exposures, dust, fumes, chemicals. Childhood respiratory infections may contribute to long-term lung damage. Pathophysiology, simple explanation. 1. Chronic inflammation of the airways. Exposure to irritants, smoke, pollutants, causes inflammation. Leads to narrowed airways, thickened airway walls, increased mucus production, chronic bronchitis. 2. Damage to alveoli, emphysema. Walls between alveoli break down, fewer, larger air sacs. Reduced surface area for oxygen-carbon dioxide exchange. Loss of lung elasticity, difficulty exhaling fully. 3. Air trapping. Incomplete exhalation, air gets trapped in lungs. Results in lung hyperinflation and shortness of breath. 4. Progressive airflow limitation. Air becomes harder to move in and out, oxygenation over time. Leads to fatigue, breathlessness, and reduced activity tolerance. Signs and symptoms. Persistent productive cough, shortness of breath, initially on exertion, later at rest. Wheezing, chest tightness, fatigue, reduced exercise capacity, frequent infections, bronchitis, pneumonia, cyanosis, blue lips/fingertips due to low O2, unintentional weight loss in later stages. Diagnosis. Aligned with Mayo Clinic recommended assessments. Pulmonary function tests, PFTs, gold standard. Spirometry measures FEV1/FVC ratio. Chest X-ray/CT scan to assess lung damage. Arterial blood gas, ABG. To check oxygen/CO2 levels. Alpha-1 antitrypsin blood test for inherited deficiency. Management and treatment. 1. Lifestyle modifications. Quit smoking, number 1 intervention. Avoid pollutants, allergens, strong fumes. Pulmonary rehab, exercise plus education. Healthy diet and hydration. 2. Medications. Bronchodilators, e.g., albuterol, tiotropium. Inhaled corticosteroids, e.g., fluticasone, budesonide. Combination inhalers, LABA plus corticosteroid. Mucolytics, to loosen mucus. Antibiotics, during exacerbations with infection. 3. Pulmonary rehabilitation. Breathing techniques, pursed lip, diaphragmatic. Exercise training, to improve lung and muscle function. 4. Oxygen therapy. For patients with low O2 saturation. Used continuously or during activity/sleep. 5. Surgical options, for advanced cases. Lung volume reduction surgery, removes diseased lung portions. Lung transplant, for end-stage disease. Prevention. Don't smoke/avoid secondhand smoke. Vaccinations, flu, pneumonia, COVID-19. Use PPE if exposed to dust/fumes at work. Regular checkups and early symptom reporting. COPD exacerbation, flare-up. An acute worsening of COPD symptoms requiring urgent care. Common triggers. Respiratory infections, most common cause, viral or bacterial. Air pollutants, smoke, dust, chemicals. Weather changes, cold, humidity. Allergens, mold, pollen, pet dander. Acid reflux, GERD. Non-adherence to medications. Symptoms of exacerbation. Marked increase in dyspnea, shortness of breath. More coughing and change in sputum, yellow/green/thick. Wheezing, chest tightness. Fatigue, confusion, or drowsiness. Cyanosis, bluish lips or fingers. Peripheral edema, leg swelling. Reduced activity tolerance. Management of exacerbations. 1. Medications. Short-acting bronchodilators, albuterol, ipratropium. Oral/inhaled corticosteroids, prednisone. Antibiotics, if infection is suspected. Oxygen therapy, for hypoxia. 2. Hospital care, severe cases. Non-invasive ventilation, BiPAP/CPAP. For corticosteroids in fluids. Close monitoring in ICU if needed. Preventing exacerbations. Quit smoking. Adhere to prescribed medications. Stay vaccinated, flu, COVID-19, pneumococcal. Practice hand hygiene. Avoid air pollutants/allergens. Use rescue inhaler as prescribed. Educate on early symptom recognition. Note, recurrent exacerbations accelerate disease progression and reduce quality of life. Early intervention is essential.